Well, Chike, on that record, it's called Good Things indeed. Good things happens to people with a lot of patience. You need to, be very, very confident that it would happen to you if you exercise some patience. So take some time and just put in the work and be sure that what is yours will not elude you. Welcome to another edition of Solutions Clinic right here on the Remedy Dial Solutions 93.9. Time check is exactly 24 minutes gone past the hour of 9. I hope that you are doing great this Monday morning and you have continually made your health a priority. Like I would always say, a healthy life is your ticket to a wealthy life. Welcome to the show. My name is Victory Richard. All right, this morning we're going to be talking about typhoid fever. Typhoid fever is a serious infectious disease caused by a bacterium. It is often associated with contaminated food or water and can lead to a range of symptoms from high fever and abdominal pain to weakness and fatigue. As of 2019, an estimated 9 million people get sick from typhoid and 110,000 people die from it every year. Severe cases may lead to serious complications like brain malfunctioning, pneumonia, meningitis, or even death. However, typhoid can be treated with antibiotics, although increasing resistance to different types of antibiotics is making treatment more complicated. Joining me this morning to lend credence to the conversation is Dr. Chukwuma Okoli. Good morning to you, Doc. It's great to have you join us.
Thank you. Good morning. Good morning, our listeners.
Thank you so much. Hope you had a great weekend.
Very well. Thank you.
All right, let's start off the conversation this morning. Remember, we're streaming live on Facebook as well as YouTube at Solutions 939 FM. So you can be a part of the conversation. If you have a question regarding typhoid fever or you have a concern you would like to raise and get some insight in that regard, do leave a comment on the comment section, or you can send a text via WhatsApp or regular text to 0904 422 2939. All right, Doc, I meant to understand that open defecation is said to be the primary cause of typhoid fever. Talk to us about that.
Thank you very much. Typhoid is caused, or happens, or let me say transmitted, when someone comes in contact with food items contaminated with feces of an infected person. So if, like in those days when people use feces as manure, yes, feces as manure, so it could be spread from that. Or any other means, for people with poor hygiene habit, you visit the loo and then you probably did not wash up properly, and then you are employed or in the services of a confectionery who sells food, and then somehow this stuff now gets into the food that is being sold out, and that way it can be spread from one point to the other. So basically that's how typhoid is transmitted, through food, contaminated food and water, basically.
Okay, so I think another question that is important this morning is the relationship between typhoid and malaria. More often than not, as Nigerians, once you feel some certain kind of way, the first thing that comes to mind is either typhoid or malaria, and you go run a test. More often than not, you just see that Nigerians will run two tests.
Yes.
They're either running for typhoid or malaria. Is there a relationship between these two diseases?
The only relationship I can say is the fact that they all affect the immune system. But in terms of pathophysiology, pathogenesis, and causative organisms, they are not related. Malaria is caused by a parasite called Plasmodium falciparum, commonly in this part of the world, from an infected female Anopheles mosquito. So it can only happen when you are being bitten by a mosquito. All right, now that's malaria. But in case of typhoid, it is a bacteria, not a parasite. It is a bacteria, okay? And then it's gotten when the Salmonella enterica or the Salmonella typhi, whatever the bacteria is called, now comes in contact with the food or water.
So why is it that you hear things like, oh, he has typhoid and malaria.
Thank you very much. Malaria is endemic in Africa, meaning an average African has a malaria parasite in his blood. So, yeah. So, even typhoid too is quite endemic. So, everybody has exposure. Now, I also forgot to mention something about people who do not practice safe water, portable water drinking habit. You know, you just fetch from the well, you go, and then you look at the house, the way the house is structured. You see that the soak away is probably up, right? And then the well is at the extreme, down. So what happens? The soak away water, they possibly percolate and then track through a tributary into the well. And then people drink without even boiling or purifying the water. So there are various means that these things can be transmitted, but that is also a verified means that water can be infected and polluted, and then such persons can come down with typhoid.
I mean, you've mentioned water, and we've also talked about feces as primary causes of typhoid, or that leads to the bacterium.
Yes.
One would think that with the level of civilization that we are witnessing right now, open defecation should be history. But according to recent data that I saw, 48 million Nigerians still practice open defecation right now. And I think not a lot of people... I mean, I just knew that open defecation is actually a cause for typhoid. So, what can we do to mitigate this?
Thank you. Okay.
Okay,
A lot.
that's...
A lot.
It took a lot from you.
A lot needs to be done. You know, there are a lot of houses without a water closet system. Yes, and since they don't have, since it is pit latrine, the pit latrine is full, and then they've not drained it out. And guess what? To drain the pit latrine now, we have the local people who will literally enter the poop and scoop it out like fetching water. Now, those ones will even charge you a lot to do that. Then we have those who will come with a truck. The last time they came to empty the soak away in the compound of the hospital, we paid almost 100,000.
Wow.
You know, so looking at it, it's not cheap. Okay, so if you say everybody should compulsorily build a toilet, then you have to make the economy good enough for them to save up money.
Absolutely.
To do that. You have to reduce the cost of blocks. You have to reduce the cost of buying sand. You know how much a trip of sand is now? You have to reduce the cost of blocks. Block is almost 400 naira per one now, even if it's 9 each, and then we have the 6 inches. So you have to encourage them. You have to make the economy friendly enough for them to be able to afford to build. So it's a long way. That's why it took me a while to answer. There's a long way. We have a long way to go. But of course, the moment you begin a journey and you make your mind up to do it, it can be done. Dubai was once a desert. But today, Dubai is one of the most visited cities in the world because some group of people in the 80s made up their mind to develop the city. We have what it takes to turn our Nigeria to a Dubai if we start.
Well, I guess it's up to the powers that be. And I mean, we also have a responsibility, as it were, because the open defecation that we're talking about is practice, by Nigerians.
Yes.
You see people just... I know that there are cases of emergency where you're pressed, and even with that, you want to hold...
We have public toilets.
Do you understand? You can just stop and get into a restaurant, for instance. Nobody's going to stop you from doing that.
Yes. And they don't stop. You just stop. In fact, a lot of people will just step in, say hi to them, go in there, do what they want to do, and when they step out, it's not compulsory. You must buy. It's a public toilet. Make use of it. I used to know of one in somewhere in Challenge some years back. I think I was traveling, and I don't know why. That's one of the reasons why I made up my mind. Anytime I'm traveling,
You don't eat.
I don't eat. So I was really forced. I didn't have a choice. I had to. And when the woman looked at me, like she felt pity, she now gave me a particular key. It was a restricted. So it was later when I was about to give her the key, she said that is the only toilet she herself uses.
Oh,
so
wow.
she reserved it for herself. I was like, wow, and you allowed me to use it. I'm so grateful. I had to use it, and then I continued on the journey, and I felt better. So really, it's possible. If we have the public toilets available in lots of locations, it will discourage shooting, like people call it.
Right. Let's talk about the symptoms of typhoid fever and what differentiates that symptom from malaria.
Thank you very much. Of course, we know malaria. With malaria comes fever. We have generalized body weakness, muscle pain, joint pain. All right, that's the common thing that comes with malaria. In case of typhoid, definitely, talking about, I don't want to go into the core clinical discussions. We have typhoid enteritis, typhoid fever. Okay, I just admitted the patient past midnight. Okay, and then I made my assessment of typhoid fever in this little girl, also having a peptic ulcer disease and all whatnot. Now, her temperature was 40 degrees. That was a lot. That's the temperature of chicken. Not that of a human. If that temperature should happen in a little baby, the baby will be convulsing by now, and a lot of stuff would have happened, but thank God. Okay, so it comes with fever as well. We have the abdominal pain, the discomfort. We have the vomiting. Okay, we have the diarrhea in severe cases because typhoid is mostly localized in the abdomen. Okay, so the symptoms that are given are abdominal symptoms, but we have others such as the cough, and we have the fever in some cases. Okay, and then generalized body
there's
weakness.
A cough too.
Yes, there is.
I get worried thinking it's TB.
No. so those are symptoms that are associated with typhoid. Though, like typhoid, malaria, they are interwoven. But it is now left for the clinician, the doctors, to take proper history and rule out one of them. Okay, this is not typhoid. This looks more like malaria. Or this is not malaria. This looks more like typhoid. So that's left for the doctors to complete in their own assessment, then send the patient for appropriate clinical investigation, make the assessment, and treat. And in cases where you can't wait for the lab investigation to come out, start your empirical treatment. And if you are right, you would see, like, there is this feeling of fulfillment that we usually have in clinical practice when patients come in looking, the anxiety is at the top, uncertainty and all that, and then you start treatment, and within minutes, it seems like, wow, doc has done the magic. This patient is calm. No, for you are just like saying under your breath, thank you, Jesus. This is done. It happened to me in midnight again. I mean, a little baby who was crying the whole day. The mom is quite elderly, and that's her first child, above 60 years of age. And then looking so worried about the child. In fact, the father kept calling, the driver, everybody was looking anxious, and it was like magic. When the medications were administered, within minutes, I even myself got up to ask. I didn't hear her voice again, and I found out she's sleeping calmly. I'm like, wow, God, thank you. Because sometimes you could do more than that, and it looks like nothing is happening.
Absolutely.
So that's it.
Fair enough. Well, you're listening to Solutions Clinic on the Remedy Dial Solutions 93.9 FM. My name is Victor Richard, and I'm having a conversation on typhoid fever with Dr. Chukwuma Okoli this morning. Just in case you have questions in that regard, do also send it on our WhatsApp or regular text line, which is 0904-422-2939. Shortly, I'll be reading these messages. We're also streaming live on Facebook and YouTube at Solutions 939 FM. So do well to jump in on the platform. So one would think that typhoid is a common disease, as a lot of people would also call malaria. However, the course of my research, I got to discover that unmitigated typhoid fever could lead to brain malfunctioning.
Yes.
Let's have a conversation about meningitis and so much more, actually.
All right. Typhoid, in its complicated case, could cause typhoid psychosis when the patient starts behaving psychotic, like someone with what many people will call mental problem. Yes, it could happen, and it can be fatal. It's highly fatal, actually. Fatal.
At what point does it get to that level?
Thank you. When it's not treated, or not treated properly, or not treated on time. A lot of people will tell you they have typhoid, they just take herbs. Some will tell you they just drink water, they take fruits, and they're fine. And then when people get to that point, you know what I do? Just sit back and I watch them, and I say nothing. Nigerians are quite corrosive. Yes, for those of us in the particular line of practice we've chosen, when you meet with people and then they just go like, doctor, are you sure? Questions that will just make you laugh, like you're asking me if I'm sure.
You know how to do your job.
Okay, thank you. I was asked to say this to you. I actually told someone, I said, am I sure? Actually, I'm not sure. They told me to say this to you, so that's why I'm saying, doctor, who told you? And the same person started validating my words back. And then when she finished, I was like, when I took almost 2 minutes of non-stop speech to explain the pathology behind the ailment you have, the next thing that will come out of your mouth is, doctor, are you sure? Okay, so that's typhoid psychosis. It's a complication when the typhoid is not treated or not treated on time or poorly treated. The patient could start behaving psychotic.
I want to understand the dynamics. How does it lead? Because this is a bacterial infection
which can pass the blood-brain barrier into the brain.
Oh.
Yes, sir.
Okay, that makes sense. So the blood is the link
yes,
to...
it is, it is, yes. So, and that's why when you take your blood samples for a full blood count and then you look for elevated white cells, the eosinophilia, neutrophils and all that are deranged. The values are deranged. When you see those values, at least that's a laboratory backing. What you need first is your clinical acumen to diagnose. That's what you need. So to this end, I always say to the clinicians, I thank God for you. You're doing a great job. You all, of course, keep getting updating your knowledge so that you can be sharp in the diagnosis. Because once you diagnose it appropriately, treatment is just a walk in the park.
Speaking of diagnosis and treatment, there's been a lot of arguments regarding the best approach to testing for typhoid.
Right.
I could remember one time that my brother was, ill, and it was typhoid. I think we went for a test, and it was a wilder test that was done.
Okay.
And the doctor said, no, that wouldn't suffice for it.
I agree. Okay, let me say this. People do Widal test for whatever intent and purpose. Widal test for me is not a diagnostic tool. That's one of the reasons why we went to medical school. We were trained on how to diagnose. It's an infectious disease. So there are other investigations that will point to you that there could be a bacteremia or a sepsis. Okay, Widal test is for aesthetics. You can just use that to say, we did this and we found out this. Even malaria can give you a positive Widal test result.
So what's the best approach?
The gold standard is to do a complete blood count. So when you do a blood count, you notice that your the white cell counts are deranged. They are, yes, deranged, either very high or very low. But of course, don't forget that you don't use that in because children. It's not common to say you're diagnosing typhoid in children. There are a lot of things. And of course, the word typhoid has been abused in the world today. Everybody's having typhoid. Well, everything is not typhoid. You could have enteritis. You could have gastroenteritis, even caused by malaria parasite. Because they could affect the GI of the children and the vulnerable ones. So it's not just about saying, every stomach pain I have is typhoid. No, it's not. That's why I always say, leave that to the clinician. A clinician who knows his onions will tell you, I don't think this is typhoid. It could be. In fact, some people, I've seen a patient who had a peptic ulcer disease and had all the GI symptoms you can imagine. And the person kept asking me, doctor, don't you think it is typhoid? And I replied, okay, if you are waiting to have a typhoid, when you're done with this, go scoop the gutter water and have a nice meal. Then we can talk about typhoid later. But for now, I will stick to my triple regimen and treat you for a peptic ulcer disease. And she recovered absolutely well.
The blood count that you mentioned, because I don't think it was blood, I think it was stool that was used for his own case.
Yes, yes, people use stool to check for ova of parasites, yes. But,
so there are like different approaches to testing.
Yeah, there are different approaches to testing. We have the blood, we have the stool, okay, but it's most commonly used, that's the blood. If you're thinking of a parasite infestation, you can check the stool. Yes, the bacteria also is actually found in infected stool or stool of infected persons. So you can also use that to alienate or to separate or to find out if the bacteria is found in the stool. Yes, you can do that because they keep excreting the bacteria in their stool, so it's also used.
Okay, I think culture tests. Okay. Oh well. Let's look at some questions that we have
All
this
right.
morning before I go ahead with my other question. All right. Good morning. My name is Comrade Isaiah DIP from Ogun State. Please, doctor, what is the cause of infection and miscarriage and the solution to them? This is out of context. And how can a husband and a wife treat infection? My second question is why is it that anytime okay, these questions are literally out of context. Okay, I don't I'll just have you read them and
Okay.
see
Okay.
if there's anything you could put out
Uh, is it possible you can dispatch this person so I respond
privately.
privately?
Okay, okay.
Yes, this is something that needs a private consultation.
Fair enough. Um Mr. Isaiah, so I'll send the doctor's number to you so you can leave a message to him, and I'm sure he would give you proper guidance on that. Another message here is okay, this is, I don't know if this is a message, but more like, why is it very difficult to get evaluation these days at the hospitals? You get a typhoid and you want to go back to see the doctor, but you cannot due to the pressure at the health system. I don't know.
I don't get this. Difficult to get evaluation.
Maybe like you follow up. If is there a need to follow up after you've?
Yes, we always give follow-ups, but do Nigerians honor follow-up? I think the only time they remember follow-up is after surgery. Once you treat them and you tell them, please check back for follow-up, they tell you, doctor, I'm fine, I'm gone, I'm busy. So I don't know
But
what
even
this
if
person
is
wants.
it easy to? Because I mean, I'm also looking at the pressure right now in the health system, being that. They say it's one doctor to 10,000, patients, as it were, and I think the World Health Organization says it should be one doctor to 600 patients, and now we're dealing with 1,000.
Yes.
So I think the health system is not even helping because I remember, so my brother recently had a knee injury,
Okay.
and we went to the hospital, and we just kept going and coming for 3 days. We couldn't see a doctor because we had so many people waiting to see the doctor as well. Maybe I'm thinking that's the direction this question is going.
Okay.
If there's a need for evaluation, which, to be honest, is not the doctor's fault as
It's
it is.
not the doctor's fault, and in a situation like that, when there is poor public-private partnership, everybody throngs the government hospital looking for health care when there are good private facilities that can do justice to it. So that is it. We have good private facilities in town. All you just need is to make your research and get the best ones, and you can have all the care you need. I've had to consult a human for 2 hours, and I remembered getting messages like, Dr. So-and-so is angry, and I just replied, if he's angry, let him leave. Do you know the situation of the person sitting in front of me? This is someone who stepped in and told me, doctor, if I don't get the answers to what I want, I know I'm going to die very soon. And I had to talk to this person, shrink this person, and then try my best to dissuade this person from harboring suicidal thoughts and tendencies. And I had to even do a follow-up on it, get someone to follow up. As he was leaving, he was heading straight to the psychiatrist and the psychologist to do a follow-up. And today, this person is back bubbling with life. And then someone is sending a message that
You're wasting my time.
You're wasting my time. Number two, do Nigerians know that when you want to see a doctor, you pay consultation? If you're not aware, today I'm educating everyone listening to me that when you go to the hospital, please pay consultation. Endeavor to pay. You are actually telling the system that you are playing your part in keeping the system running. You don't pay consultation, or you are told to pay and you say you will not pay. So who to pay? When you come back tomorrow and you don't meet the doctor on seat, what do you think happened? Probably the organization couldn't afford payment and the doctor had to leave to go elsewhere. Or probably that even potentiated the doctors traveling out. They are moving out in their mass. Let me tell you, Nigeria is depleting of doctors on a daily.
Absolutely.
So we need to wake up as a country. We need to wake up. Things are going from bad to worse in this country. I'll just stop there.
Surprisingly, there's a vaccine for typhoid
Yes.
fever.
You know, like I said, I don't want to go, like, this is a social discussion. So it's not a clinical meeting.
Well, let's
Yes.
talk about that. How effective is
Okay. Yes.
the vaccine, and how can people access it?
Thank you. Now, in typhoid endemic areas like Africa, all right, the whites are always told, or people are told, when you want to go to a typhoid endemic, not just Africa alone, of course, we have other countries, yes, Asia and co. If you want to go to typhoid endemic
I think
areas,
it's even more in Asia.
yes, get the vaccine. There are vaccines for it. Make requests. The vaccines are in the government facilities, okay? So just step into any government facility, tell them what you want, and then they let you know what it will cost. Get vaccinated. And then if you need any evidence to show, because it's possible that you get into such countries and then the officials will tell you, if you don't have the evidence that you've been vaccinated, don't come say that you came here and you got this from us. Right. So there is a vaccine and it is available. It is readily available, in fact, available on demand. So yes, there is a vaccine for endemic areas. And if you live around here and you feel like, hey doc, I'm prone to typhoid. See, the problem is this: if you don't seek for proper explanation, proper documentation of your complaints, and then proper clinical assessment, then you will be filled with the wrong information. And Nigerians are good at propagating falsehood without getting the proper information. Please be sure of what you are at risk of. Be sure of what you get exposed to and it affects you. Be sure exactly what it is, and then seek for help, because help is available. The vaccine is available on demand.
And it's effective.
It is very effective. I used
Is
to
it
have-
something that you also have to take like a booster dose, or the one shot serves you for life?
Yes, no, it's not for life. It's not like that. Tetanus. even tetanus toxoid that will give you a lifetime vaccination, you take after a certain number of times. But the clinicians will always tell you when to come back. Okay, look at the COVID. So, look at
There
the
are
COVID.
several
There
doses that we have to
booster
take.
doses, yes. Initially, we were told we have dose 1, dose 2. Now we are now told we have booster doses. So collect your booster dose. You're traveling, you go get all those things. So really, the clinicians will tell you, they will even give you a time frame to come for your next dose. So it is important. And if you are listening to me and you feel like you are prone to typhoid, you want the vaccine, it's fine. Just visit your clinician. Let him validate the fact that you are treated and you are healthy and fine. Then you can be vaccinated. You can't take a vaccine when you haven't treated the ailment that is still in your system.
That's fair enough. Well, the messages are coming in. If you still want to send, do that to 0904 422 2939. 0904 422 2939. I have a message here from Cynthia from Ojo, and she says, "Good morning, doctor. Please, can typhoid affect the brain to the extent that the brain will be making noise or something moving around my brain?"
Wow. I'm sorry about that, Ma. Typhoid affects the brain, like I mentioned about typhoid psychosis. But the point of brain making noise, I don't know if the brain makes noise. It's only the mouth that
Can you
makes
even
noise.
determine?
Yes. So
I don't know. Well, it's her feeling, but
yeah, it's a feeling. It's how
yeah.
she understands it. My suggestion at this point, Ma, will mean visit your verified clinician. Social media now has verified handles, verified stuff.
Right.
Look, the clinicians too are verified. And who verifies us? The Medical and Dental Council of Nigeria, the Nigerian Medical Association. So visit your verified clinician and let him assess, him or her rather, assess you, and then they will tell you if what you are feeling is how you felt it or it is actually what is happening.
That's fair enough. Another message here is from Toy, and she said, "Good morning." She's saying, "Good morning to you, doctor. My question is regarding my boy. He's always complaining about runny stomach. We've done tests, and it's not been typhoid. I don't know what the challenge is."
Okay, I would have loved to know the age of the boy, but it looks to me like a little boy.
Clearly.
Okay, yes. I've seen such comments from time to time about people presenting with stomach pain in the child. It happens. The truth is hand to mouth. I call it hand to mouth. Okay, as adults now, we know that it is foolhardy for us to dip our hands in our mouth because we are everywhere. You've been through many offices this morning, and you're right here in a studio, which is a public place. People come from outside to meet you here, place their hands everywhere, touch the button, so you're not expected to put that same hand in the mouth. Even if you have to eat swallow, I'm sure you're kind of person who would want to use a spoon.
No. No, it's not.
So, But for children, you can't control how they do. As a matter of fact, some of them, I actually was watching a boy some days ago, and he sat down, and after 2 minutes, he left the chair. He wanted to sit on the ground, and the mom was like, "Control yourself." And throughout the period of consultation, she was struggling with the boy sitting down, and I just felt like, nah, just to sit down. Just to sit down. So you can't control how they put their hands in the mouth. They go out there, touch everything touchable, introduce the same hand into the mouth. So from time to time, they are loading their systems with bacteria. So you keep having such a child having repeated abdominal complaints and pain and all that. And that's because from time to time, they keep loading their mouth with bacteria.
No hygienic practice.
Yes. So that's where the challenge is. So I think it's best that such child should be taught about hand sanitizing, okay? And then even if you want to still load the hand, like you would have dipped it and remembered and removed it, but at least you are dipping a sterilized hand into the mouth and not a hand loaded with lots of bacteria. Some, it is their parents' car key. Some, it is the cotton. They just want to put something in their mouth. So these are the challenges that we have with repeated presentation of people having issues with their tummy. It's from what they ingest. So in such cases, it will be recurrent. Parents most times feel like, I've been to the doctor, I expect that, hello, sir and ma, the antibiotics you took been spent just less than 48 hours in the system and is already out. So don't think that, oh, I treated him last month and he's having the same. The child keeps loading bacteria, keeps ingesting bacteria, and that is why they keep having complaints over and over again.
Ultimately, hygienic practices is the only thing that can stop that. And for children, I don't think to take a lot of work for that to happen.
Yes.
Speaking of antibiotics, I did mention earlier that one of the fighters to curbing typhoid is resistance, and it's very common.
Yeah, very, very common.
It's very common.
From acute to chronic to resistant. And like I said, treatment on time, treatment with the right antibiotics. Those are the two things that we should always look at. When the person is not properly treated or not treated on time, it could go chronic and they just begin to excrete the bacteria and they are now the ones propagating it in the neighborhood.
For people who have built the resistance, is there something that can be done?
Yes, sir. You do a blood culture. So when you do a blood culture or you do a stool culture or whatever it is, you would now be able to do a sensitivity. Sensitivity is after you have grown the bacteria, you now put a drug disc around where the bacteria is growing, and after a while check for a place where there is no growth. If there is no growth, it means that the bacteria in that area has been killed. So that particular drug is sensitive and will be used to cure the resistant situation.
All right. Good morning, doctor. My name is Sam from UI. Can typhoid suck or reduce blood from the brain or bloodstream? And what kind of antibiotics do you suggest?
Please, can you take that again?
Good morning, doctor. My name is Sam from UI. Can typhoid suck or reduce blood from the brain or bloodstream? And what kind of antibiotics do you suggest that I use? I think we're not allowed to mention.
Yes. Typhoid sucking blood from the brain. Even malaria does not suck blood from the brain. But like I said, it's a feeling. This is how this person feels like. Okay, so sir, allow me to say, these feelings are fine. We do get lots of complaints like this, but I think it's best to visit your clinician. Let him assess you and first diagnose you with typhoid. And let's be sure what you have is typhoid and not long-lasting and severe malaria or even resistant malaria. And like I said, they share symptoms. They share headache. Yes, headache, dizziness, fainting attack. Lots of things are involved, and there are similar symptoms to both conditions. So at this juncture, I think it's best for the clinician to diagnose you properly of what exactly it is, and then a treatment will follow in that regard. Thank you.
All right. Well, so I'm going to leave the doctor's number. But like you said, consultation is not free. So I'm going to leave his number on your WhatsApp. So for some of you who sent in messages, you can always reach out to him. I'm sure because of the instrumentality of this, I'm sure your consultation will not be as loud as anybody who is coming to the hospital directly. So you can always reach out to him and get more details and get more answers to your concern in that. Thank you to everyone who sent. I have another message. We're pressed for time. We'll take this very quickly.
Okay.
Okay, good morning to you, Doc. My question is regarding some of us who use public
Yeah,
toilets.
I talked about
Does the
that.
droplets from the toilet lead to one's infection?
Yes, it does.
You know, that makes sense because
Yes.
I remember even with, the water system, that drop
Yes,
that.
it does. That's I actually went to a place and then I saw they had this thing that looks like a pump or something that will spray water. And I was
Okay.
like, wow, whoever put this in here,
It's
thank
smart.
you. Like, yeah, very smart. So it will, and that's why you should be wary of using public toilet. But if you are pressed in my kind of situation that you didn't have a choice, like, come on, what can be more embarrassing than soiling yourself on a journey? And then to avoid that, you just have to make do with what you find. Make sure you clean and wash up absolutely. Wash up very well. Just with clean water, you can push out all those bacteria. They don't have a glue in their body. They can't stick to you. Once the clean water comes at a pressure, it pushes them out.
Well, thank you so much, Dr. Chukuma Okoli. This has been quite an insightful conversation this morning. I'll be back next week, Monday, with yet another subject on health. This is Solutions Clinic. It happens every Monday from 9:15 a.m. to 10 a.m. My name is Victoria Richard. I hope that you continue to make your health a priority. A healthy life is your ticket to a wealthy life.
Ẹ káàárọ̀ nílùú Ìbàdàn. Solutions 93.9 FM.
In my lifetime, people have to die for them be like too. Everybody no go like them, they no go like them. I wanna be me, don't wanna be like you. Some of them they want to go body. Where them they when I be nobody. If I talk truth, them I come for me. But if them talk truth, they want my company. They want my company. Big love to mama, she raised the man, a young king. And blessings to friends that hold me down. For loving me. More light to the fans, you changed my life. That shit. And big ups to me, I never give up. I just wanna win. In this life of sin. Every other day I gotta win. Win so hard I make up sin. I'm up, I just wanna win. Wahala could come me. Every other day I gotta win.